So we now welcome Professor Katharina Wirnitzer, a sports scientist and professor of sports public health focused on child health. Her research at the crossroads of sports, vegan nutrition and sustainable health has shaped nutrition policies in Germany and Austria. She also advises the platform for TCI care under the Czech Ministry of Health. Professor Wirnitzer, please go ahead.
Thank you very much. Good afternoon. I would like to start with something completely different than my talk. I would like you to join me with my tribute to the dedication of all the volunteers here at the World Health Congress to support Thomas to make this Congress a big success. Please join me and give an applause to all these volunteers who are devoted to this wonderful Congress. Thank you very much. From my side, I appreciate much what you're doing. So, now in delay already, I will talk about how to prevent diseases on a population level and rather not to go for the need to see a doctor, how we could avoid that, and what the individual has to do with that, inclusive the schools. So, when we talk about public health, we have to talk shortly about terminology. It's about us, it's about the public, and we have a lot of subpopulation within a population like Czech Republic or Austria or India. And within these populations, we also find vulnerable populations like seniors, people with disability, lactating and pregnant mothers, and for sure, children. But at the end, it comes down to the connection between the individual and the public. How can we do so? And I did a search in the scientific databases because I wanted to know how long these terminologies are already at service in science. And I found that public health was considered first time in 1940, and it was already connected with school and education. This was new to me. And when coming from my field, sports, I was searching for how sports contributes to public health. I found that in 1945, childbirth was considered an athletic effort. This was interesting for me to see. But even before, there was public health nutrition between the end of World War I and World War II, because there was poverty, malnutrition after everything was destroyed. And so, again, the considerations was how can we supply or give support to the children to support their health. And child public health, finally, searching for that term is from the public health start. It was in 1851, 58, child murder. Well, this is not so much connected to health. But in 1861, since then, this is the longest term, child public health, at service in science, and we find it in different documents, early documents, and it's from the very origin connected to school and education. And this is wonderful because this is my topic. And if we want to summarize now this and create a picture, this could be a take-home picture, what it's about to talk about public health and child public health with its specialty disciplines and working areas of sports and nutrition public health. So we are here, we are at good state of health, but without health, we couldn't contribute to a joyful and happy life. So health above all, this is the mission, and that's why it's not by coincidence the fundamental human right, and that's why it's picked up by big intergovernmental organizations. And this aligns perfectly with the prevention first appeal and call to action by the European Union or European Commission since 2019. And this seems coming easily over my lips, but it's a big paradigm shift and challenges the medical profession much, because to prevent, to get ill, they are not so experienced in. So this is a big challenge and a major step. And we have to consider that although health is a major topic and written down in all the agendas, in the major agendas, we have to solidify healthy behaviors and habits as early as we can, because It tracks over a lifetime. It tracks from childhood into adulthood and senior age. And we are not so flexible at the age of 60, 70 to change something, to go for modifications. And so from the Dahlgren model already of the social health determinants, we know that there are frameworks to go for that, but well, it's not so much or not so effectively implemented. And this brings us to the health paradox, which is up nowadays. We're living in the 21st century with high-tech medicine and high-tech equipment all around, but still, there are skyrocketing numbers of increasing risk factors and non-communicable diseases and mortality rates. So, and at the same time, health is for free. Healthcare is at high cost. You can buy it for your money, but health is for free. But you have to earn it over a lifetime. And you can start every second to make modifications. And in 1550, it was first mentioned that if you want to go for a better health, you can do right now, right an hour later, right tomorrow. But you have to do it yourself. Don't go to the doctor and expect working wonders. So yesterday I told you that we are not talking like this very, very kindly and very loudly, but we do the hard work in the background. Please visit our website. It's full of publications, and these are massive publications. And I hope, Thomas, you can keep up the conversation with the Parliament after the election this weekend and use our hard work to go for good and shape policy. So back to the health paradox, I checked the numbers of Austria and Czech Republic because it's nicely comparable as the populations are nearly the same. It's thrilling in a negative way that Czech Republic has to spend about nearly 30 million euros in total to treat the consequences of insufficient physical activity. So this means also the loss of productivity because of sick leave at the job. And also it's worse with obesity and overweight. It's about 9 billion. It's unenthusiastic figures so far. And we have to overcome that. And even if we dig deeper in that, we see that very unenthusiastically, only 6 out of 100 people in Europe lead a healthy life. And this is the average. It's 6%. Not a good average. And even below 6. Austria and Czech Republic is performing. This is a non-performance, a low performance. But we can change that together. And when we look even at the mortality rates and the risk factors and the drivers to that, again we see that in Czech Republic and also in Austria, 9 of 10 people die from non-communicable diseases. And the first and second killers are friends we know, cardiovascular diseases and cancers, amongst others. Type 2 diabetes is also among them. And when we now look to the risk factors, it's that factors, these modifiable factors, we can control ourselves. Why don't we do? It's a rhetorical question, but necessary to raise. And it's an old story, and it didn't change, that the adult populations are not at good health. It's pressing health concerns around the world, and it worsened over the COVID-19 pandemic. And even the kids are now at even worse health than before. And it's nearly the same figure in Austria and Czech Republic and in many other countries, that major fractions of the children don't get enough physical exercise that is considered healthy and do not get enough healthy food items like fruit, vegetables, whole grains, and beans, dietary fiber. So it's not a good position to start. However, like yin and yang, it's always two sides of the medal, and with the risks we have, which is negative, there is the solution delivered in the same way. And we can get now to be more active, and we can get more healthy food. And it's a sound recommendation, these two lifestyle factors and modifications, but you cannot run away arteriosclerosis and clogging arteries, but you can eat away arteriosclerosis and clogging arteries. So this means it's the most severe impact factor, diet, but it is also the most powerful modifiable factor we can use to heal ourselves. And the question is there a super formula out in the outer space or on planet Earth? Yes, there seems to be a solution. And we can learn from the healthy centenarians, from the blue zones, that, especially from Okinawa, there might be a wisdom. And it's not a new wisdom, it's just eating more plants, as Okinawa elderly are eating 95% of their calories from plants. And this may be connected to how they act and move every day, how they're active, amongst other important factors, to be honest, that makes them to live a healthy 100 and beyond. So maybe there is more than the Okinawa diet or an optimized Mediterranean diet. I guess this is not the upper limit. So health is a choice. We know this already. And the good news is that of all these factors, 30% of what we can do for our health, we can control ourselves. So it's time to get back this control. While at the other end of the spectrum, although we need the medical system, mostly for emergency cases, and this, I'm grateful for that, but this is at the end of the story when we have an accident. But the most impact the individual has itself or himself, herself, oneself. But we have to earn it by everyday actions. And this is more struggling. Some more prefer to go for the $1 million pill. And we know since COVID times, there is no such things like the $1 million vaccine or pill. We have to do it ourselves. So let's together make this healthy choices the easy choice. And well, we know this formula, it's all around through the century, I guess through the millennials, we know this, it's an ancient wisdom. And this formula is just compacted as the heal approach to sustainable health through the lifespan. And this is what we can apply from childbirth to senior age. It's very simple but very cost effective. So to unlock the power of lifestyle, we have two role models where this dual approach to health was applied. Olympics 2024 and the European Football Championships. 60% of the food offerings were made vegetarian and vegan in the athletes. So this is the world elite at the start, so it works. It works. And why not go for that? For the athletes, for the spectators, for the media, for the staff, they provided and showed the world going for high performance and winning medals and being most sustainable works together, it aligns wonderfully. And why is this? The young people have a strong will and desire to shift towards more sustainable lifestyles for their own health, but also to heal the planet. And we know since the FAO report of 2006 that in every agenda since then, it's outlined that animal products destroy the planet and destroy our health. When it comes down to the climate change, to loss of diversity, land use, water use, etc., but also when it comes down to increased risk factors, to infectious diseases and increasing numbers of non-communicable diseases. And let's say we are at planet Earth, a spaceship. When we look at the World Overshoot Day, we, also Czech Republic and Austria, we perform not very good. Already end of March, at the beginning of April, we have consumed all our resources. That means if the spaceship has to go to December to go to the end and the harbor, we have to starve from April to December and couldn't turn on the heating because we consumed already everything. This is not good news, how we do and how we act on planet Earth. And when you look at the reports for the nations, those nations perform worst on sustainability who eat or consume the most meat, dairy products, and eggs. And at the same time, regrettably, the EU is also following the science-based data, because 80% of the European agriculture subsidies are given to animal products or animal producers, livestock farmers. It's not evidence-based, but they do. We have to stop that. And at the same time, The EPCC Technical Summary Report, it's for free, please refer to this, points out that the greatest shift potential comes in switching or going to vegetarian and vegan diets. Go veggie, they say. And it's since years. And not only the EPCC, the WHO also published on that, a big report, free on the internet. The Eat Lancet Commission. Very few people know that the Eat Lancet Commission is a continuum between, or from the mixed diet to the whole food vegan diet. So you can apply every dietary pattern with that. But why don't we go for that? But the very first wonderful, most sustainable food guideline was the power plate of the PCRM years ago. And with their educational material, they shaped ground because copy and paste, the Harvard Medical School and also the US government took the power plate and developed their own mixed dietary guidelines. However, the US are changing. But at the same time, to come back, we have a big lack of knowledge in the professionists, in the nutrition sciences and in the medical sciences, because there is a lack of training and education. 75% of the nutritionists think and believe plant protein is incomplete, which is totally wrong. And even the doctors don't know about the power of exercise for healing cancer and other treatments. And also they do not know about the power of foods to heal. And as a vegan, I experience very often and share this with others that I'm better educated and better know about that than the doctors. And the doctors don't know that diet now outperforms smoking as the highest risk factor, the most serious killer. And we already published with a call in the COVID-19 times, with a call that there is a need to upgrade medical education and training with other life sciences like nutrition sciences and sports sciences. So not only talking, we do a lot in the background. And there is a lovely professor from Indonesia. I would recommend now some literature that goes beyond. So Bashwati yesterday mentioned things that people who are very progressive and try to get their speech and not to let us fight down, are just labeled negatively very often, although we follow the science. And here, we may have a nice professor joining us, and also ChatGPT predicts together with us that although we are mocked and discriminated, even today, ChatGPT thinks that in 2070, the world is by default on a vegan diet. And this aligns wonderful with the ahimsa principle, which in my personal and professional life is one of the highest values to follow. And this aligns also with the heritage of Martin Luther King and his son Dexter King. So please, Will Tuttle and his World Peace Diet shall be a must-read for everyone interested in that. So we do a lot of work in the background. We study populations in the secondary schools and at university level, and we have seen that the better a diet, the more healthy a diet is getting, the better other lifestyle factors are pronounced and posed. So when we see at the weekly level and also as a leisure time activity, the more someone is eating vegetables and the more someone is vegetarian or vegan, the better the activity patterns are. There are significant results. And even if we see the alcohol consumption, even if we see, where is the point? Even if we see that the students like to party a bit more than the kids, we see that there are significant differences. So they are more health aware. Regrettably not when it comes down to smoking. Smoking seems still very cool among the young, but well, we can also work on that. So, and also at the interface where primary school children transit to the next phase in their life, to secondary school, we did some research with a systematic review, and we found out that health promotion and health education is most often mentioned in the context of sports and exercise and physical education, and not nutrition. This was new to us. We thought differently. And when we compared the Austrian, Swiss, and the German curricula, we saw that it's in all curriculum over black and white written down that there is much potential, but mostly what I follow in my professional life, the dual heel approach to health. It is black over white, literally written down that there is a direct link. And from this role model, we can even tap more when we explore other school curricula, like in the Czech Republic and so on, maybe also in Italy. So, just summarizing and not reading every line means we are very active in the background. We want to contribute for good, starting with the young populations. And the prevalences for these more healthy diets, vegetarian and vegan diets, are rising. And Derek Tain, who is now graduating at my lab, has done a lot of research with a focus on sports and exercise, Prisma reviews, which is the gold standard. And recently he published with our lab a nice paper on health interest and nutrition knowledge, and the health knowledge, interestingly, was significantly better in the vegetarian children. Why is this? Because the adult population studies show us that's the vegans. Returning to the slides where I said there is a lack of knowledge in the professionists, maybe the parents with their novice vegan kids are overreft. There is an overload because they don't get support by the doctors and by the nutritionists, so they don't know how to help their kids. But the vegetarian diet we know since the 1970s well, and we are familiar with that, but maybe not so much on the parental level and on the professional level than with the vegan diet. However, there will be much more from us in the next years. And we do also make policy or help policy making. Our work from the school study was considered last summer in the updated position statement of the for the vegan diet from the largest nutrition society in the German-speaking countries, the German Society of Nutrition. This was massive. This was a massive step. And also the Austrian recommendations picked up our work to contribute. And from summer 2024 to December, our work was considered also in setting up the new dietary guidelines in Austria with a more sustainable plate. And it's revolutionary for Austria, high mountains, eating a lot of meat. We not only have an optimized mixed diet pyramid, we now have, for the first time in history, a vegetarian dietary pyramid. For Austria, this is massive. And we're happy that we were there. Regrettably, and this is the dark side of the medal, most nations don't care about the latest evidence when they set up and update their new dietary guidelines. So only a few follow the science. So also there is a lot potential. Thomas, also here we can move mountains, hopefully in the next 20 years. And we even think beyond how we can qualify the teachers, the health professionals, the nutritionists, and the future medical doctors and teachers. So, and we also go mass media because the people have to know. If not the doctor and the nutritionist tell you, someone else has to tell you. And this was just from May this year, and this is now a latest report, also Austrian nationwide, which was published 4 days ago on 30th of September. So we try at all levels to do a lot to contribute for good, to make health in all policies, which HIAP stands for, a future, not only issue, but a future reality. So it's prevention. Rather than going to see a doctor, we have to avoid that the person has to see a doctor. So it's about that 70% of what we can do is preventing us for diseases, maintain a good health state, and if we are healthy, promote our health even better. And in the second or last row, well, we need therapy. And even in the therapy stage, healthy eating, active living can contribute with all the other lifestyle factors. And when it comes down to the children, we must not forget the schools and the lessons. Coming back to the Dahlgren model means we have to start with the individual. For vertical permeability and for success of all that frameworks, we have to understand how this is connected. So I skip a bit faster now. So why our health policies of nations are doomed to fail? Because they do not consider the schools. And why is this? When we look at Czech Republic and in Austria, we have about 20% of the population is children. They have to spend 9 years compulsory at the school time at minimum. And 40% of their wake time every day they spend at the schools. This is a massive potential we do not tap fully so far. So there we have to go. And there is consensus about the policymakers, the experts, but there is a lack of will or a weak will for accorded interventions, accorded efforts. And so it's health education. It starts at schools with the curricula. It's written down as overarching educational principle. And with this, the door opener is physical education. So, I can skip here. How can we go for Czech Republic to counsel you? These are my last slides. Well, it's about policy, law, decree, bills. And we have role models. Portugal in 2017 was the first. 2023, Denmark set up an action plan for the whole nation to emphasize plant proteins. We have to go for the school curricula. This is, in short, not only to support the kids, but to go over the full lifespan with a healthy and high-quality life and well-being. We have to follow the role model of the Olympic Games and the European Football Championships to offer at public canteens, from the kindergarten to hospitals, nursing facilities, nursing facilities, vegetarian diets. And we have also for this role models. One of the latest is New York City Mayor Eric Adams. And we have to go live, hello world, outside. This massive knowledge, this evidence must go out to the people where it belongs. And near to the end, Czech Republic is already at the starting line. So why don't use what the media says, that Czech Republic is ready for going veggie. So it's our duty to stay committed and to be committed. So with this, if we want to take over control, the lowest level everybody can do, a child and a senior, is to be more active and modify what you eat. At WHC Prague, it's easy because vegan food is delicious, but you can do when you're at home, just buy any bite new. But when we want to start with the children, we have considered the schools, and we must take into account that the door opener and the starting point is physical education, the compulsory subject. And with this, I want to refer to Dr. Derek Taylor's talk on Sunday, who explores and explains why a whole food vegan diet outperforms even an optimized Mediterranean diet. And I would like to refer also to the poster downstairs of Dr. Katharina, which is also part of our team, on the details of canteens going vegetarian and vegan. Thank you very much. Enjoy this conference and let's celebrate together.
Thank you very much, Dr. Wirnitzer, for showing us what can be done so our children grow up healthy. Thank you.